A pleasant day to everyone, or might be in your case, good afternoon and good evening. Once again, I'm Sir Roy, and for this week's topic, I will be presenting you the different transfusion-related infections, or more commonly termed as your transfusion-transmitted diseases. So, as for the categories of transfusion-transmitted diseases, we have viral infections, we also have bacterial infections, and parasitic infections. And class for parasitic etiologic agents, we are mainly referring to your hemoflagellates and tissue protozoans that are mainly capable of thriving within blood and blood units. And I will also be presenting a few of the clinical features of some of the transfusion-related infections and their disease characteristics, etiologic agent, and the diagnostic markers. So, okay, class, for the rest of the following slides, we will not be including the cytologic or molecular level of the disease mechanisms and their complex pathology. Number one, viral infections. Hepatitis is the generic term or the general term for the inflammation of the liver. The liver cells or your hepatocytes are damaged with cell swelling, or what we call as the ballooning effect, that results to cellular degeneration and eventually necrosis as either eosinophilic bodies or acidophile bodies or cytoplasmic fragments of ruptured hepatocytes, which actually makes it more of fundamentally associated with secondary to an immune reaction. When the number of hepatocytes that were destroyed from the infection, or primarily as the result from the necrosis, results to a very few healthy hepatocytes remaining to maintain basic liver function, we term the disease progression as fulminant hepatitis. So the hallmark characteristic of your hepatitis, or a person infected with hepatitis, is jaundice, or the yellow discoloration of the skin, gums, what else? The sclera of the eyes, and is also characterized by having a dark yellow or amber urine. So a recall from your clinical microscopy. Okay, on each of these following slides, class, these are more of an overview, but I have included the necessary and important details for each of the diseases. So, as for hepatitis A virus, this is a 27 nanometers non-enveloped virus with a nucleocapsid that belongs to the picornavirus family, which is a single-stranded RNA virus. And take note, class, that hepatitis A virus is the most common form of all the human hepatitis viruses. So it has an incubation period of 15 to 45 days only, and that is the main reason why it is termed as the short incubation hepatitis. And the onset of the disease is often acute and has a recovery period of 7 to 21 days by range. And that is exactly why, class, there is no potential disease progression to a chronic state hepatitis, and the mortality rate is very low at less than 0.5%. The most common route of transmission is via fecal oral route, and the viral replication actually takes place in the liver, and the virus is excreted through the biliary system into the feces. So, aside from being termed as short incubation hepatitis, your hepatitis A is also called as infectious hepatitis and is most commonly seen in an epidemic orientation to highly urbanized areas with overcrowding and poor hygiene and sanitation. So, again, guys, hepatitis A virus is very stable, and it actually can retain both of its physical and biologic activity at 60 degrees centigrade for 30 minutes. So, as for the diagnostic markers, we have first have antigen, or the HAV antigen, and it is shed in the feces of um, infected individuals during the incubation period and early acute stage of infection, and eventually declines to low levels by the symptoms occur. So this is the main factor. HIV antigen is uh, not actually clinically useful indicator used since the virus appears in the stool prior to the appearance of symptoms, and the serologic tests class for antibodies to HIV are more definitive in establishing diagnosis to infection to HIV infection. So your IgM anti-HAV is the marker of acute hepatitis, and it peaks during the first month of illness and declines to undetectable levels within 6 to 12 months. While IgG anti-HAV is the marker of immunity to hepatitis A virus. It is produced as a result of your antibody production after the sensitization of the plasma cells via natural immunity or via immunization. Hepatitis B virus is a 42 nanometer double-stranded DNA virus that belongs to the family Hepanavirus, and it is surrounded by a lipid and protein surface coat. It has an incubation period class of 30 to 180 days and was termed as your long incubation hepatitis, and often demonstrates an insidious the disease onset. So aside from the blood transfusion, um, the most common and the classic route of transmission class is the sexual route, preceded by the parenteral and the perinatal transmission. HIV infections may progress actually to chronic hepatitis and often results to a higher risk of cirrhosis and what else hepatic carcinoma, and has a mortality rate of less than 1.2%. So your HBV infection has a rate of 5 to 10% of disease progression to a chronic state hepatitis. The two most remarkable hepatitis class, two most remarkable hepatitis related terminologies um, from our medical literature is the infectious hepatitis, which is basically your hepatitis A infection, and serum hepatitis, which is your hepatitis B infection. So, hepatitis B actually contributes to 10% of the post transfusion hepatitis that were recorded in our medical literature. So, other than long incubation hepatitis, your HBV infection class is also termed as serum hepatitis and post-transfusion hepatitis. And additional class, your HBV virion particle is also termed as your very famous Dane particle. And this particle is found in all of the body fluids and secretions of an infected individual. That includes, of course, number one, blood, also includes saliva, semen, what else? Urine, sweat, and also colostrum from breastfeeding. So, okay, class, tabulated here is the simplified descriptive pointers and everything we have to take note and remember about the three stages of hepatitis B infection. So, we have the carrier state, the chronic state hepatitis, chronic persistent hepatitis, and the chronic active hepatitis. In a carrier state, uh, this is where a patient who has hepatitis B surface antigen in the blood for 6 months with normal liver function tests, which includes your ALT and AST, or your SGPT and SGOT respectively. For chronic persistent hepatitis, this is a patient who has abnormal liver function tests result with normal liver biopsy specimen. And for the chronic active hepatitis, is a patient who has an abnormal results for both liver function tests and liver biopsy sample. So these are the diagnostic markers for HBV infection. So, class, your HBs antigen, or technically called as HB-SAG, is also known as the Australian antigen. Actually, it has four basic subtypes that are mainly found on the surface of the Dane particle. We have the ADW, ADR, AYW, and AYR, which will be discussed in an elaborate manner in your IS lecture. Hepatitis B surface antigen class is the first marker to appear in the serum of an infected individual and is typically detectable within 2 to 12 weeks after exposure to hepatitis B virus, and that is exactly why it is a very useful in pre-transfusion testing or screening of blood donors. Next is HBE, or the Hepa B envelope antigen. It indicates high infectivity and actually demonstrates a very high vertical transmission risk when found in the serum samples of blood donors or from patients. And it is actually present during periods of active replication of the viral particle. So last is your HBC, or core antigen. This is actually not detectable in serum because of the viral envelope that masks or that covers the core antigen. However, it can be detected via liver biopsy of infected liver cells or hepatocytes. So for HBV antibodies, we have five markers. First is the anti-HBC total, which describes the total antibody against your core antigen and actually a lifelong marker of the past exposure to the hepatitis B infection. For antibodies to the core antigen, we categorize them into IgG and IgM antibodies. For IgM anti-HBC, it is used as a marker of an acute HBV infection and also a marker of a present or current infection. This is the main marker class that is utilized in detecting infections during the window period. So take note of that window period. And for IgG anti-HBC, as opposed to your IgM, this is the marker for chronic hepatitis B infection, and this is the predominating antibody detected in the test for the total anti-HBC. Okay, take note that IgG anti-HBC persists for the lifetime of an HBV infected individual. Next is anti-HBE, which is the marker of um, convalescence, or the marker of recovery, or the marker of low infectivity of blood, and a marker of good prognosis. Lastly is your anti-HBS, which is the last marker to appear in the serum sample, which is also utilized as a marker of immunity and past infection. So let's take note that HBs antigen, or surface antigen, or HB-SAG, is the first marker to appear. And the last marker to appear is your anti-HBs antibody. So it is utilized for um, as a marker for immunity and past infection. And actually, class, it appears as a response of our normal immunologic activity obtained via exposure and via Hep B vaccination. That is your anti-HBs antibody. Hepatitis C virus is under the family Flavivirus, which is also a double-stranded RNA virus that ranges from 40 to 80 nanometers in size range. It has an incubation period of 50 to 150 days, and similar to your Hepa B class, it is also often has an insidious onset of the disease and commonly transmitted via parenteral and through sexual route. Your hepatitis C infection class has a disease progression rate of 40 to 60% and is associated with zero point 0.5 to 1.0 mortality rate. And take note, class, that HCV infection, or hepatitis C viral infection, is the leading cause of liver transplants in the United States, and it is also termed as the non-B virus or the non-A, non-B hepatitis virus. And it contributes to a roughly 90%, take note, class, of this value. It contributes to 90% of the post-transfusion hepatitis, and that is according to our reference Henry's. And according to our medical literature class and statistics that were recorded in our medical literature, as of to date, hepatitis C is elusive and is a more serious problem compared to hepatitis B. So, as for the diagnostic markers, we generally perform two test generations for these markers. So, for the first gen testing is done by detecting the antibodies to C100-3, which is associated with the viral replication and infectious state of the virus, while the second gen testing and the most sensitive and specific testing is via detection of antibodies to C22-3 or the viral core structure, C100-3, and C33 C, which is a cytoplasm bound viral marker. And your ALT or SGPT, including anti-HBCHCV, are the surrogate tests used to screen blood for hepatitis C virus. Okay, lastly, take note, class, that hepatitis C infection is the most significant transfusion transmitted infection. Moving on with your hepatitis D or the Delta virus. Okay, class, this is actually the most unique hepatitis virus among the other forms because it is actually a defective single-stranded RNA virus that requires a hepatitis B virus surface coat for its replication. So, meaning to say, it does not actually appear as a singular infection because it needs the surface of a hepatitis B virus. So this virus is a 35 to 38 nanometer single-stranded RNA virus which was discovered by Risetto in the year 1977. So as I have mentioned earlier, that this is an envelope particle uh, with an outer surface coat of the HB subconstituent. It is also termed as delta hepatitis due to its viral etiologic agent, which is primarily transmitted via parenteral route and is commonly a severe infection. So your hepatitis D is more frequently associated as severe infection. Okay, take note, class, that hepatitis D infection actually occurs in two clinical variants. We have the co-infection and the super-infection, along with their the table here, along with their manifestations and incubation comparisons. For co-infection, there is a simultaneous infection of hepatitis B virus with hepatitis D virus or the Delta virus, and it has an incubation period of 6 to 12 weeks, or actually more than this incubation duration. While for superinfection, there is HDV infection in patients with chronic hepatitis B infection and has an incubation range of 2 to 6 weeks. And class superinfection actually has a higher rate of mortality associated with the what we call as fulminant hepatitis. And like your any other hepatitis markers, IgM anti-HDV is evident during acute phase, and IgG anti-HDV is evident during convalescence period. So we have here are the other hepatitis viruses of much less of clinical importance than the former presented hepatitis viruses. The hepatitis E virus is known as the enteric form of the non-B hepatitis virus, which is a non-enveloped single-stranded RNA virus having the most common causative factor is through sewage contaminated drinking water. This virus was first recognized from urbanized areas and countries with low standards of living and low standards of the practice of hygiene and sanitation, particularly in the 1970s, and was recorded to have had occurred 20 years earlier in India. It has an incubation period of 1 to 10 days. And lastly, we have hepatitis F and G viruses. Hepatitis F virus class causes hepatitis which is not attributive or attributed to the five known viruses, while hepatitis G virus is the etiologic agent of the syncytial giant cell hepatitis, which is most often seen in pediatric patients with an extremely rare occurrence of infection to adult populations. Moving on with viral infections, we have the human immunodeficiency virus, which is the causative agent of AIDS or AIDS or acquired immune deficiency syndrome. It belongs to the family Retroviridae and contains RNA as its nucleic acid and a unique enzyme, the reverse transcriptase, that basically transcribes RNA to DNA. Reviewing our infectious diseases from immunology, there are basically two types of human immunodeficiency viruses, your HIV-1 and HIV-2. HIV-1 is formerly called as human T-cell lymphotropic virus 3 or HTLV3, love or lymphadenopathy virus, and ARV or AIDS-associated retrovirus. It was first recognized and discovered by Luc Montagnier of France and Robert Gallo and J. Levy in the United States. HIV-1 class is further classified into three isolates. The group M, or the main group, who is actually responsible for the majority of HIV infections. Group N for new group, and outlier group for group O. Your groups N and O class are largely confined to parts of West Central Africa. So HIV-2 is actually a related but a distinct virus from HIV-1, and it is endemic in West Africa with a lower rate of transmission and less pathogenic compared to HIV-1. The most classic routes of transmission is through an intimate sexual contact preceded by contact with blood or other body fluids such as blood, semen, vaginal secretions, CSF or cerebrospinal fluid. What else? Interstitial fluids such as synovial, pericardial, peritoneal fluids, and most definitely all other body fluids that contains blood. This can be transmitted through sharing of needles, well, of course, blood transfusion, use of clothing of hemophiliacs, and occupational injuries with needle sticks and sharps, and mucous membrane contact with healthcare workers that are exposed to infectious fluids. And lastly, perinatal route or transmission from mother to infant that can actually happen during pregnancy, or also the transfer of blood during delivery and via colostrum or breast milk feeding. So, as for the disease pathology, it results to a persistent infection or infections that is, in technical terms, class is capable of vastly destroying the immune system by extremely jeopardizing the cellular immunologic responses of the infected individual. And the prime targets of the virus are the CD4 T helper cells. And the decrease in CD4 T helper cells has been recognized as the hallmark feature of an HIV infection. So when the CD4 T cells declines to less than 200 cells per microliters, is already diagnostic for AIDS or AIDS. And in an HIV infection class, there is a clinical evidence of the reduction of cytotoxic T cell activity, a decreased delayed hypersensitivity responses, and a characteristic decrease in the monocyte macrophage system chemotaxis activity, and of course, a decreased NK cells or natural killer cells activity. There are three HIV stages, and for the first stage, there is high levels of viremia, and HIV begins to proliferate within lymphoid organs such as the bone marrows, spleen, lymphoid organs such as lymph nodes, and others to name a few. Okay, in both clinical and theoretical point of view, infectious mononucleosis-like or flu-like symptoms starts to arise within the primary infection. that usually appears 3 to 6 weeks after the initial infection. However, class, okay, take note. Some patients are also asymptomatic during the stage of primary infection. So while in the clinical latency is the evident decrease in the viral loads and is characterized by the absence of symptoms. Take note, class, that the length of the clinical latency can vary in individual patients depending on their immune system, but typically it would last for several years. So last is the AIDS or AIDS, which shows signs of a very profound immunosuppression and the appearance of life-threatening infections that are mostly opportunistic and including malignancies that includes um, pneumocystis carinii pneumonia, the disseminated mycobacterium infections, and the most common yeast infection in an HIV infected individual is the Candida albicans, and also we have Kaposi sarcoma, which are the most classic mortality infections caused by the immunosuppression in an AIDS or AIDS infected individual. Next, we have here the HDLV types 1 and 2, which are actually both classified as retroviruses, having HDLV1 as the first retrovirus associated with human disease. And these two viruses class are commonly transmitted through blood transfusion, also sexual contact, and parenteral route. HTLV1 is human T-cell lymphotropic virus 1 and is known to cause diseases like adult T-cell leukemia and HTLV1 associated myelopathy or tropical spastic paraparesis, or um, just termed as HAM and TSP. And TSP class was the first recognized disease association of HTLV1 from West Indian patients, while HTLV2 disease association is hairy cell leukemia, or um, T cells associated hairy cell leukemia. And take note, class, HTLV1 can readily be inactivated by organic solvents, detergents, and heating, but they are resistant to ultraviolet light and X-ray radiations. Next, with viral infections, we have CMV or cytomegalovirus, which is the largest of the herpes viruses and is also known as the human herpes virus 5. Other than blood class, it can also be isolated from or recovered from saliva of the uninfected person, vaginal secretions, semen, and the milk from breastfeeding. And it is also known to cause lifetime infections, which are most particularly more serious in immunocompromised infected individuals, because it is also a disease infection found during HIV infection. Clinically, the main target of the CMV are the peripheral blood lymphocytes, which for a direct cytologic examinations of a CMV infected individual will demonstrate the characteristic owl eyes, which is actually or basically a large basophilic inclusions within the nucleus of the cell with expanded cytoplasm, and that is how it is also termed as cytomegalic. So take note that this is the most common cause of congenital infections and the second most common cause of mental retardation in newborns, next to Down syndrome or trisomy 21. A single cytomegalovirus can survive for hours and on surfaces and skin of individuals who happen to contract the virus, and they can survive for a 4 degrees centigrade storage temperature for a few days, but loses their infectivity at negative 20 degrees centigrade. CMV class can also be inactivated by lipid solvents, since it is a lipid coated viral particle, also in storages of acidic pH and high heating procedures. And lastly, leukoreduction class or white cell filtration from component preparation can minimize the risk of transmission of CMV on blood transfusions. EBV or Epstein-Barr virus is a herpes virus that causes infectious mononucleosis, which is characterized as an infectious disease of the reticuloendothelial cells. And okay, a recall class from your virology. This disease is frequently affecting young adults of 16 to 25 years of age. And the other names of this disease includes kissing disease, and the most remarkable one is the kissing disease, and well, because it is transmitted through saliva. It is also called as glandular fever, and it demonstrates the presence of atypical reactive lymphocytes, or also known as your Downy cells. Okay, class, take note. The most remarkable disease association of EBV is Burkitt's lymphoma, while hepatitis is the most common disease complication. So other than your hepatitis viruses, EBV can also cause hepatitis infection. So one of the hallmark of the Epstein-Barr virus infection is the evidence of an increased heterophile antibodies. So class, in most of your board exam reviews, when we say heterophile but antibodies, we are actually referring to your Epstein-Barr virus. So in an EBV infection, there is an increased heterophile antibodies. The infectious mononucleosis heterophile antibodies appears on the first week of infection and normally peaks within third to fourth week. Aside from IM heterophile antibodies class, we also have the Frostman from Salmonella and Shigella, and the serum sickness, which are serum sickness heterophile antibodies, which are antibodies in response to parenteral injection of horse serum products during immunization. Next, we have parvovirus B19, which is a small single-stranded DNA non-enveloped virus that has been discovered in 1975 from the serum of a normal blood donor. It is the main causative agent of the childhood disease erythema infectiosum, or also known as your fifth disease, which is clinically characterized by slap cheek appearance when localized on the face and a lacy red rash when localized on the neck portion or region. And class parvovirus B19 also causes the adult disease poly, sorry, polyarthralgia. So the childhood disease is the erythema infectiosum or the fifth disease, while the adult disease is the polyarthralgia. This viral agent, or your parvovirus B19, actually needs RBCs for its viral replication as a transport host for the replication, and the actual replication class will occur mostly or particularly in the bone marrows, erythroid progenitor compartments. And this mechanism results to the most common findings in the parvovirus B19, which is the reticulocytopenia. So next, for viral infections, we have here are the West Nile virus and prions. So as for West Nile virus, this is a double-stranded lipid enveloped flavivirus that causes human, avian, and equine neural-related infections. The first outbreak of West Nile virus class was first recorded in the year 1999 in Queens, New York. One of the most unique capability of this virus class is that it can permeate the blood-brain barrier, causing meningoencephalitis-associated diseases that are medically termed as West Nile encephalitis, West Nile meningitis, or West Nile meningoencephalitis. This virus is mostly carried by Culex mosquitoes. Next, we have prions, which is a small proteinaceous infectious particle that actually and do not technically have the ability to invoke immune responses. However, class, it is believed to have carried the Creutzfeldt Jacob disease that causes one death per million populations per year. These were believed to have transmitted from donors who have been recipients of the human growth hormone. And this is the exact main reason why, class, that recipients who have received growth hormones should be deferred permanently. Next, we have number two, bacterial infections. So, contamination due to a technical error or technical errors is one of the main reasons of bacterial proliferation within blood units. Propionibacterium class is a normal skin microbiota and was one of the most common bacterial contaminant in the red blood cells. Most bacteria do not actually survive on storage conditions, most particularly due to the low temperature storage and the citrate anticoagulant which inhibits bacterial survival. But take note, class, that bacteria that are able to survive are primarily gram-negative bacteria. However, a few gram-positive bacteria like Staphylococcus, Epidermidis, and Bacillus cereus were also have been isolated and recovered from contaminated blood units, mostly platelet concentrates. Since concentrate class is basically stored under room temperature conditions, and this is the main reason why platelet concentrate units are the most prone to bacterial contaminations. So, okay, class, for these succeeding slides, just like from the rest of our transfusion transmitted infections, are general overviews of the diseases and a little less of the disease mechanisms and their pathophysiologic cellular concepts. So, we have here syphilis and the Lyme disease. Syphilis is caused by Treponema pallidum, which is a spiral bacterium or termed as spirochaete morphology and cannot survive for 4 degrees Celsius for more than 72 hours, but will remain viable when frozen. And it represents three clinical stages. So, as for the primary stage, it demonstrates the period of the development of chancre sores, while secondary stage shows the development of generalized rashes. And for the latent stage or the tertiary stage, syphilis stage, it is clinically evidenced with the neurosyphilis and cardiovascular syphilis, which is often the cause of the mortality with individuals infected with syphilitic infection. But as of today class, there is only one case of transfusion transmitted syphilis that has been recorded to have occurred in the transfusion practice. And according to the book of Dennis Harmening, donors that have confirmed with positive results can be reinstated for blood donation after 12 months with proper documentation of the treatment courses. So next is borreliosis or the Lyme disease, which is caused by Borrelia burgdorferi, and it is commonly spread by Ixodes damini, which is the chief vector of the Borrelia burgdorferi. Okay, remember that this bacteria can survive in blood and a blood that is or blood units that is stored at 1 degree centigrade to 6 degrees centigrade and can also thrive in frozen plasma and platelet concentrates. Yersinia enterolytica is the most common bacterial isolase, specifically found in red blood cell units next to Pseudomonas species. So both of these bacteria class contributes to more than 80% of bacterial infections that are transmitted via red blood cell units. So Yersinia enterolytica is actually more viable at higher temperature class. However, it can also thrive under refrigeration temperature storages. And ultimately, about this bacteria class, it attains high rate of bacterial proliferation when subjected or inoculated to an iron-rich environment such as RBC units. And that is the main reason why, class, they are most often associated with RBC units contamination. And at the same time, iron-rich environment actually heightens their virulence factor while they releases endotoxin that reaches fatal or deadly concentrations or dangerous concentrations for at least 21 days of storage. And also, Yersinia enterolytica is also associated as a frequent bacterial infection in patients suffering from transfusion-associated iron overload. Lastly, aside from contamination of blood units as a route of transmission, Yersinia enterolytica is often and is normally transmitted via contamination in milk, water, tofu, bean sprouts, and turkey chow mein, which is a Chinese cuisine food. Okay, number three is parasitic infections. So, like what I have mentioned a while ago, parasitic infections in the transfusion-related infections are mainly the hemoflagellates that actually thrives and have the blood as part of their life cycles. And of course, including tissue protozoans, since they are also mobile parasites that has the capability to migrate from tissues to the blood system and vis-a-vis. So the most common and remarkable parasite in the transfusion transmitted infection is the malaria, which is caused by your Plasmodium species. So your Plasmodium species, we have Plasmodium malariae, Falciparum ovale, and Vivax. And a recall from the other blood group system, your Duffy negative and ENA neg phenotypes are resistant to malarial parasite invasion. And actually, most of the transfusion transmitted infections are a result of unscreened blood units and accidental transfusion of infected units. So before kasi, only testing for hepatitis B and syphilis were performed as a part of the blood donor unit testing for infectious diseases. And that's exactly why there is actually a law that has long been efficient in mandating the performance of a complete and proper testing requirements, which was also the same law that gave the nomenclature to different categories of blood donors, donor screening, and so on. So another recall class, aside from being illegal, receiving blood units from paid or professional donors was marked as one of the former leading cause of potential transmission of transfusion transmitted diseases. And that's the main reason why receiving units from these donors, the paid donors, was said to be dangerous. So moving on, the frequency of malarial infection in non-endemic countries is less than zero point 0.2 cases per million population per year, while the frequency in endemic countries is equal or greater than 50 cases per million population per year. Having the chief vector, of course, we all know this, the chief vector of malaria is a female Anopheles mosquitoes. Chagas disease is caused by Trypanosoma cruzi, which is a hemoflagellate and at the same time a tissue protozoan. Its normal and main reservoir are opossums and raccoons, and the organism can survive for at least a duration of 10 days in refrigerated storage conditions, and it can also remain viable for 10 days in the presence of citrate and has been recorded to be isolated from a frozen plasma unit. So the primary transmission is via bug bite, or most commonly known as your redovid bugs like Triatoma rubrofasciata and Rhodnius prolixus bugs. Next is Babesia infections that are caused and basically characterized via demographic locations. Babesia microti is the predominant causative agent in the United States, while Babesia divergens in European countries. So microti and divergens class are initially both zoonotic infections. Rodents by microti and cattle for divergens having their chief vector the northern deer tick or Ixodes damini and Dermacentor species. So we have here a few pointers. According to our medical literature, parasites can remain infective in blood after 14 days of storage, and there were only 2 reported cases of Babesia transfusion transmitted infection as to date. And these 2 reported cases were blood donors that happened to have a travel history in the Cape Cod area. Next is toxoplasmosis that is caused by Toxoplasma gondii, which is mainly carried by felines or domestic cats. So aside from accidental transfusion of infected blood units, The most common source of transmission is via contaminated water or drinking of contaminated raw milk and via transplacental passage from mother to fetus. The highest rate of transmission were recorded from Parisian women. So, class, here are a few of the important and additional must knows about our topic. So, your HIV, hepatitis B virus, hepatitis C, HTLV, Epstein-Barr, CMV, and also an additional, including human herpes virus 6, causative of Rosola infantum, and human herpes virus 8 with disease association and Kaposi sarcoma are all viruses with lipid envelopes, and these viruses are inactivated by organic solvents and detergents, with the exemption of hepatitis A virus and parvovirus B19 because these two viruses are resistant to organic solvents and detergents. So technically, class, all viruses are abiotic particulates or non-living particles, and which means that the term killing or kill is an inappropriate term for viruses, like on what we always see on advertisements and on products, because we cannot actually kill the non-living, right? But the most appropriate term is inactivating the virus. And they actually use the word kill just to make it more technical term for mass consumers, or more likely a colloquial term. So moving on, okay class, this is a very common and a frequent board exam review question. When the question asks for the most significant transfusion transmitted infection, the answer is hepatitis, most particularly hepatitis C infection. But when the question asks for the most frequent transfusion transmitted infection, the answer is bacterial infection. And that ends our lesson on the transfusion transmitted infections or diseases. Once again, I'm Sir Roy. Thank you and have a nice day.